Hello, my name is Olivia Harris and I'm a student physical therapist here at the University of Cincinnati. Welcome to my TED Talk. Today I'm going to be talking to you about fear avoidance and its role in chronic pain. So what I'll be touching on is what is fear avoidance, why is it so important, and what can we do as clinicians to help somebody who is dealing with it. So to start with a quote from Dr. Gordon Woodall, "The fear of pain is worse than pain itself." And this is found to be true. This is probably something that you've heard from your parents, your grandparents, your doctors, maybe when you went to get vaccinations when you were a child. You heard it's really bad. You heard that the shot hurts so bad, and you spend days, you spend hours thinking about how that little shot's just gonna hurt terribly. And when you get it, maybe the shot really isn't all that bad. But what sticks with you is the fear that you brought into the clinic, and that makes you not want to go back to the doctor anymore because you don't want to be scared again. Well, something like that can also happen when you have an injury. So this is kind of where the fear avoidance model can come into play. So what happens when you injure yourself? Maybe you sprained your ankle, maybe you threw out your back, maybe you pulled a muscle. So this could really be a source of some severe pain. So at this point, this is an acute injury. So maybe the injury is swollen, the area is swollen, maybe it's a little irritable, and you want to avoid that movement that you did because you don't want to cause that terrible pain again. So for example, we've all slept bad on our neck before, and then the next day, if you turn your head in that one direction, it just sends that shooting pain down your neck, down your arm, and so all day, the last thing you want to do is turn your head that direction. Well, this is okay to do for a few days while that acute injury subsides and it makes you feel better just not to move it at all. But the problem is for some injuries and some people, they can create this adaptive strategy that they actually avoid this movement long term to avoid the pain, but this actually leads to further damage. And that's when this becomes a problem. And so this is how acute episode of pain can actually turn into chronic pain. And that's how this fear avoidance really comes into play, and that's where we can talk about this model a little bit more. So this is the fear avoidance model. We start here with the initial injury. Now this can be the real injury that you had that caused the pain, or this can be any threat or trigger that takes you back to that injury. So you're emotionally overloaded. You heard words that have triggered you, or your disease has triggered you. And that comes down here to this decision point. So are you going to fear the pain, or are you not going to fear the pain? And that either leads over here to a positive road to recovery, or it leads over here to the negative feedback loop. So first, let's explore if we are to fear our pain. So that comes over here to pain catastrophizing. And this means you're having irrational thoughts about your pain. It's the worst pain ever. It's going to lead to injury. It's going to lead to horrible things, and it's just the worst pain that you've ever had. So what can feed into this is bad experiences. So being told that you're never going to recover, having a lot of medical testing, hearing various opinions from doctors, getting information from the internet or WebMD that's just always terrifying, and then just not having the right knowledge, because you're getting all these from, if you're getting all your information from the internet, then that's not a reliable source, and you're overwhelmed by what your doctor is saying, and so we're just not having the right knowledge about our pain. And so we're having irrational thoughts of our pain, which leads to fear of movement and fear of re-injury. So we're terrified now that even if we move like we did, that we're going to re-injure ourselves, and then we're never going to get better. So allowing those irrational thoughts to just keep on moving. And that comes up here to avoidance and escaping any movement and just being very fearful of movement and re-injuring yourself. And this fear just continues to lead to disuse, disability, and depression. So you're no longer moving, you're in fear, and this leads to all these things. And this just goes right back into that fear of movement and fear of pain, and it just goes around and around in a loop. And you can tell how exhausting that might be. But if we come here, and we even come from this loop, but we get educated, then this can lead to no fear of our pain. And so this is where we can have knowledge and we can learn about the non-threatening behavior of pain. And people can really talk to us about the things that we need to know, and that no, we're not going to re-injure ourselves, and that movement can be very helpful. And that helps us confront our pain, confront our fear avoidance, and lead to the road to recovery. So what this fear avoidance model is really saying is that pain-related fear comes from interpreting pain as a threat, and this is whether or not it's a fresh injury or something chronic that has already healed. So once you catastrophize about this pain and avoid movement, you can interpret every single sensation as pain, and you can interpret every single sensation as a threat. And this can be fed by misinformation and terrifying doctor's visits and a bunch of medical testing. So this can make you withdraw from the things that you typically enjoy doing, leading to depression, disuse, and eventually disability. However, we can stop this loop, and this doesn't have to be the case. If we can teach about the non-threatening nature of pain and stop fear avoidance from developing, then this allows somebody to continue their daily activities, stay active, and live a happier lifestyle. Unfortunately, a lot of people who struggle with chronic pain believe that increased activity, movement, and exercise can make their pain worse and also lead to more damage. And this isn't the only thing they're worrying about. They don't just worry about fear of movement. Chronic pain can be a very stressful condition. Some other questions that they might have is, will this pain ever go away? How long until I get back to normal? When can I return to work? And is there something seriously wrong with me? So this is something that us as clinicians need to be aware of, and that's why we have something that can quantify it. So we use the Fear Avoidance Beliefs Questionnaire, otherwise known as the FAB-Q, and it's a series of questions about physical activities that you would expect to cause pain or expect not to cause pain, and your beliefs about pain in general. So this is showing that if you have a higher fear avoidance, that you are more likely to have a longer recovery from disability. So you're probably asking now, so what is the big deal? And my answer to that is that fear avoidance is something that can affect somebody's everyday life and their overall health and their overall wellness. So there's been a few studies that have looked at this in the workplace, and what they have found, one study looked at low back pain, and they found that higher fear avoidance regarding physical activity was linked to higher self-reported disability as well as higher self-reported pain. And they found that fear avoidance of their occupation in specific, actually, if they have high fear avoidance of their occupation, that this led to decreased work ability. Another article that I found was pretty similar. It was also looking at chronic low back pain, and they found that with high fear avoidance regarding their occupation in specific, they were associated with continued sick leave, no improvement in disability, and no improvement in pain for over a year. So this is affecting people's occupations, and it can lead to people having prolonged disabilities, and that's a really big factor in somebody's life. So this is a really big deal, and it's something that we need to pay attention to as clinicians. So the big question for the end is, what can we do about this as clinicians? So one way that we can lead this is through patient education. And so one, we want to explain the relationship between movement and pain. We want them to know that it's not a bad thing after all, and as long as we are past the acute injury phase, that's actually something that we want them to do. So looking at movement as a non-threatening behavior and something that can actually heal your body. So that's something that we need to talk to them about. We also want to introduce them to the fear avoidance model. So the diagram that I showed you earlier, we can use that as a resource to give our patients, to give them a visual of maybe what's going on. And you can tell them right there what feelings and what movements and what actions are leading to the disability curve going around and around and around, leading to pain catastrophizing and leading to disability and disuse. And we can also show them on the other side, we can give them examples of thoughts and behaviors that can put them into that positive feedback leading to recovery. So that is a great tool to be able to show people and really give them a visual of what's going on so that this is a real thing, this is something that we can solve. Another thing that we can use is psychological interventions. And one thing that has been widely researched in fear avoidance is cognitive behavioral therapy. So something that would be used for this is changing how these people assess their pain. So no longer looking at pain as this horrible threat that's causing damage to their body, but rather something that's just another sensation. So like I said before, if you have high fear avoidance, you may see every single sensation as pain and every single sensation as a threat. So this therapy would specifically work on how you're assessing those things and changing that for the better. Another thing that you can do in cognitive behavioral therapy is eliminating those catastrophizing thoughts of movement. So no longer looking at movement as something that's terrible and bad for you, but rather changing it within your mind, how you think about it. Another thing that we can use psychologically would be mindfulness, which is really thinking about yourself in the present moment. And it's not even just ignoring your pain, it's really thinking about your pain and then moving on from it, not letting that be the whole focus of your entire day, letting it take over your life. Another thing that I thought was really great was exposure therapy. So this is something that is used for a lot of phobias. And so what you would actually do here is have them perform their most feared movement, but in the supervision and encouragement of a clinician who is there to tell them that this is okay, you're not going to hurt yourself, and here's the real outcome if you are to move and try to be more healthy. So this has actually been shown to decrease someone's perceived disability as well as decrease their fear avoidance in general. So that's really great. Another thing that we can do is physical activity to help them, which maybe you would think is exactly what they don't want to do, but it can actually be really beneficial, of course. So what we want to do is progressively return them to daily activities. If these people are marathon runners, we don't want to just throw them back in a marathon after they haven't moved for a long time. Instead, we want to go on a graded exercise program, getting them to become stronger, maybe start with jogging, and just really making our way slowly to getting back so that there isn't an injury and we're not really letting that fear take over. Also, exercise, strength training, and yoga has been associated with decreased fear avoidance. So those are techniques that we can use for exercise for our patients to help them get rid of this fear avoidance and have them get stronger. And then lastly, mobility and motor control exercises. These have been associated with reduced pain intensity, so really focusing on how you are moving and seeing how that's not causing any pain and getting people more active. So, patient education, psychological interventions, and physical activities are all ways that we can help these people get over their fear avoidance and help them live a healthier lifestyle. So this has been on fear avoidance and chronic pain. I hope that you've learned something, and just know that we can help these people and that this is a big problem that we need to take into consideration when we're treating people. So thank you for listening.